A dislocation is when two bones that come together to form a joint become separated. It is most commonly happens from a sudden hard collision of two objects. Dislocations are common in high contact sports like football and hockey, but it can also happen from repetitive motions as well. For example, serving a volleyball or pitching a baseball. There are two main types of dislocations. A luxation is a complete dislocation where the joint is separated and completely out of place. A subluxation is a partial dislocation. Your bones are still touching, but just is not completely as usual. The bones that are affected by a shoulder dislocation are bones of the pectoral girdle, which include the scapula and clavicle. The humerus and also the labrum, or the cartilage of the glenoid cavity, are affected as well. The muscles that are affected are the rotator cuff, which include the supraspinatus, infraspinatus, teres minor, and the subscapularis. The deltoid, bicep, lats, triceps, and pecs are also affected. The movement of these muscles help with circumduction of the arm. Diagnosing a dislocation can only be done by a doctor. A physical exam of the injured area may show signs of blatant dislocations, but sometimes X-ray or other radiology imaging may be required for a diagnosis. Dislocations can have severe complications like nerve damage, damaged blood vessels, and broken bones. If left untreated, it can have negative lifelong effects. Since the shoulder has a wide range of motion, it can displace in several different ways. The first way is an anterior dislocation, where the head of the humerus dislocates forwards towards the clavicle. This is the most common type of dislocation. Usually it can be from a fall where the arm is abducted and externally rotated. A posterior dislocation is where the head of the humerus is dislocated backwards behind the scapula. This is less common than the anterior dislocation. This is usually caused by a direct blow to the front of the shoulder. The last type is an inferior dislocation, where the head of the humerus is dislocated downwards towards your feet. This is the least common type of dislocation, where it is usually caused by a forceful hyperabduction of the arm. Common symptoms of a shoulder dislocation include joint pain in the area, swelling and bruising, inability to move the joint, and the bone is visibly out of place. Treatment of dislocations are usually closed reductions where anesthesia is given so that the doctor can manipulate the bone back in place. The joint is then immobilized by a sling or other piece of ortho equipment so that the joint can heal in its proper place. Doctors will give medications like pain reducers, anti-inflammatories, and muscle relaxers to help with the pain after a dislocation. The joint will need plenty of rest after this injury. Later in the healing process, stretching and physical therapy may be necessary to gain range of motion back in the limb. Worst case scenarios, surgery may be needed if the doctor is unable to manipulate the joint back into place. You can't always prevent a dislocation. They usually happen because of accidents. There are some things you can do your best to try and prevent these injuries, like including proper stretching before any game or exercise, the use of all protective gear, staying hydrated, and taking proper breaks in game. If you are recovering from a dislocation, it is best to take things slow when returning to your sport and make sure you are fully healed before returning.